Today I'm joined by Jason Drummond, CEO of MedPal AI. Jason, great to have you on again. How are you doing today?
I'm well.
Good stuff. So big update today with MedPal announcing the launch of a 24/7 automated medicine distribution center. First of all, it looks like you've moved really quickly here, given you only took on the pharmacy license from Universal earlier this month. Has this been in the pipeline for a while, or was this a all hands on deck situation to get things going as quickly as possible?
I think when we announced the acquisition of the assets of Universal, we tried to give an idea that actually it was an amazing opportunity for us. It was basically a facility that was distributing 25,000 prescriptions a month, but unfortunately not really thought of its own. It had gone into administration, so it was just a brilliant platform for us to launch our strategy around really making healthcare instantly accessible and affordable for everyone. So it's bringing together our app and AI, advanced AI, which basically replaces kind of the GP kind of gatekeeping with intelligent, so AI assessment, and basically this a facility which you probably saw we've expanded it 3 times. We've taken the 2 adjacent units. It's the reason it's very interesting, and maybe this didn't come across when we first announced the transaction because it looked like a small deal, but people didn't really understand the significance of it. It's got a DSP license, which is called a distance selling pharmacy license, which enables us to basically ship medication across the whole of the United Kingdom. The GPHC actually stopped issuing those licenses in June of this year, so it's an incredibly valuable thing to have. That was key, and it's based on a particular location. So we were able to effectively lease the 2 adjacent industrial units to create one mega center, and we just signed contracts to basically deploy the latest BD-ROA VMAX advanced robotic dispensing systems and the Omnicell VBM systems. So effectively, you're combining, if you think about it, the sort of cutting edge AI that we built around the MedPal app with robotics, which enables us to dispense incredibly quickly. I mean, the stats: a robot can dispense over 200 times quicker than an individual, and it's incredibly accurate. It's actually far more accurate as well. So really, the reason why we're combining these 2 incredible technologies, robotics and AI, is this really, my game was the strategy was always about how do we make healthcare literally instantly accessible and affordable for everyone, and that's really what this is doing. So it's pretty significant. We're very excited. This facility can run 24/7. We have a capacity already of over 100,000 prescriptions a month, so that's a 4 times increase in where Universal started. So yeah, it's a great announcement.
Yeah, absolutely. I mean, the robotics side of it sounds very futuristic. Are there many other similar facilities in the UK, or is this kind of blazing a trail a bit?
I think Boots announced literally the launch a couple of weeks ago of a facility, which they put in a robotics for their repeat prescription business, which is interesting. So there are 1 or 2 big players, but no, we're going to be one of the bigger players in this market. We're absolutely committed to building out regional DSP infrastructure, which enables us basically to just deliver this strategy of making healthcare accessible for everyone and instantly. So these facilities are running 24/7. You can imagine a situation, and this is the kind of why I started MedPal, is that you wake up in the middle of the night, you realize you've got a throat infection, you go on MedPal, go on the app basically, in 90 seconds works out what the problem is. It basically does like an AI triage. It hands you over to a prescriber who just checks the AI's kind of ideas and work. It gets approved. A robot picks basically your medication, and we get it shipped out to you, and by breakfast you can have the medication. That's really what we're trying to build. So yeah, it's exciting. It's a fully sort of integrated sort of healthcare stack, right through the app, right through to access to the independent prescribers and the GPs, through to the ability to actually deliver in real, same day, next day.
Absolutely. I mean, that sounds ideal given how difficult it can sometimes be to get hold of medication when you need it. So sticking to that.
And time consuming. I mean, imagine this is literally we can basically in 10 minutes deal with a problem that you could have taken, an hour to get through to your GP. You then got to convince your GP that actually you're really ill and you need to get one of his valuable, one of the valuable slots that day, or maybe get to see a GP if you're lucky within 2 or 3 days. You've got to take time off work. A lot of people can't take time off work in the way that maybe older people can. So younger people, this is a really big issue. and then you get access, but basically for free. So we give you free access to clinicians. Can you imagine? So within minutes, you've got your problem dealt with, and the medication is on its way to you.
Yeah. Talking of people who are working, you mentioned them in the RNS as a key market. Do you think they're sort of being underserved at the moment then by the system as it stands?
Yeah, absolutely. I think there is a better way of doing it, but the reality is it really required a company like MedPal to come on to build the AI, to build the technology, combining what really makes this happen and this work is combining literally best in class AI with the robotics. That's really key. I mean, if you think, a lot of young people have grown up on this kind of, this Amazon, with Amazon, which basically kind of really changed retail, right? So I think the strategy is what we're trying to do. What Amazon did for retail, MedPal is really trying to do for healthcare. So this maybe is our Amazon moment, replacing physical infrastructure with digital, first experience, using automation to massively drive down costs, instant delivery, same day, versus perhaps with pharmacies, it can take you a week to get the medication. So it's literally, operating 24/7 rather than the limited hours of an existing pharmacy. Most pharmacies only work between 9 and 5, so we're opening it extended hours. So yeah, no, it's basically bringing the same, really, I guess, what Amazon did for retail, MedPal would do for healthcare, making it accessible for young people, so they don't have to take time off work.
Definitely. Perhaps we can look back on this as the moment it happened then. You mentioned,
I hope so.
Yeah, you mentioned one of the initial areas of focus will be weight loss medication. Is that because it fits particularly well with what you're already doing on the MedPal app and what all the data?
Absolutely.
Yeah.
Well, I mean, I think the weight loss phenomenon is just a total gift to MedPal. The app basically is all about creating a better, healthier version of yourself. I think there is a very good way to do weight loss a bit more ethically than some of the existing providers. We already track your weight, we track your BMI, we take all of your stats via all of your connected health devices, from your Oura Rings and your Fitbits and your Apple Watches. We already have all that information. So if you want to go on a weight loss journey with a GLP-1 like Wegovy or Manjaro, we can actually help you with that whole process. We can track you. We can also just do it in a much better, more ethical way. And the reality is, look, it's also good for business. I mean, 2.5 million people are already on GLP-1s. That's 500 million pounds a month being spent in the UK alone on that medication, and people are getting incredible results. I mean, the average weight loss is 20%, which is just incredible. It's a huge market, and yeah, it's a great opportunity for us. And we're now going to be, going squarely into that market, but in a very kind of, I think, in a very ethical way. We can track your results. The AI can look at your results and say, hang on, we can see your training. You're going to the gym. We can see that you're hitting your weight loss targets. Maybe you should come off the weight loss medication. Maybe you should reduce your dose. So we're going to do it in a really, really clever way, a way that no one's doing it currently.
Sure. So it's not just about prescribing; it's also about then managing.
That's crucial.
Along that.
Absolutely.
Yeah. So from the business side,
and that's the whole strategy. I mean, our whole strategy is two things really. I mean, firstly, as I said, it's really giving healthcare instantly accessible and affordable for everyone. And the other thing is, you've probably seen it on our adverts and so on, is helping people live better lives for longer. And that's our strategy.
Definitely. So are you able to tell us anything about the sort of scale of revenue you believe you'll be able to generate with both the app and this center live?
Well, one of the interesting things we're going to track is, and this information is actually available independently, is the number of prescriptions that are going out the door. There are already tables. The NHS publishes prescription information. Obviously, it's a combination of private prescriptions and NHS prescriptions. So, we're in a brilliant position. We can do both. So we're set up. We can do both private and NHS. We have an NHS contract. So, for example, you can either go through our app and access to clinicians and so on that way, or actually, if you go and see your GP, you can connect MedPal to your NHS account. So whenever you go to a GP, MedPal can actually fulfill your prescriptions same day, next day, and so on, which is really obviously really exciting. But in terms of the numbers, I mentioned that Universal was doing 25,000 prescriptions to 30,000 prescriptions a month. The capacity there is now increased, I would say, significantly over 100,000 prescriptions. To put it into monetary terms, the lowest amount basically you can receive for a prescription, which is an NHS prescription, is around £10. So in a very simplistic way, if all we were doing is basically NHS prescriptions, then it would be £10 times by 100,000 gives you kind of a number.
Yeah.
Obviously, if it's private prescriptions, Mounjaro is a lot more expensive. So Mounjaro is £200 to £300. So per prescription. So, but certainly you could say that the lowest price could be £10 a prescription, which you can start tracking that.
Definitely,
it's big numbers.
Yeah, I mean, it gives us a good ballpark to look at moving forward. In terms of scaling up over the longer term, I wanted to ask: does your license that you took from Universal allow you to launch more centres? I mean, I'm talking over the longer term here, but is that the goal?
Yeah, I mean, well, firstly, we have, so it's a DSP license, so we can supply the whole of the United Kingdom through this massive facility, the state-of-the-art facility we're building in Swaffham in Norfolk. So that's really good news. In terms of the legislation, there's a new legislation called Hub and Spoke, which enables us to do some very clever things regarding having regional hubs. But certainly, I think we're going to scale this business very quickly. We think there's huge demand. I mean, who doesn't want instant access to affordable healthcare? I mean, it's a real problem that we're solving, and I think that's really every business I've built. And I've scaled some businesses before, like FairFX, over 1 million customers. That we had a brilliant exit at Christmas for the investors last year for that. We've got great experience. I have a lot of experience in scaling these businesses. So yeah, I think watch this space. You've seen what we've done in, I think, 6 or 7 weeks since we IPO'd the company. We're not hanging around.
Definitely. I guess the final question is, with the app and the centre in place, what's next for the company from here? Or is it? Yeah.
Well, if you remember, we have deals with the biggest, Europe's pretty much biggest employee benefits company. Yeah. We have access to 22 million employees across 4 or 5 key markets, including 11 million customers of eParcy in the UK that have gym memberships. So we're actively rolling out the app across that huge network. Also, we did a deal with the Independent Gym Network, which is again over 2,000 gyms, which gets us access to around 2 million gym members. So, we're busy rolling out the MedPal app to nearly 13 million gym members and gym goers in the UK, which is pretty exciting. And obviously building out this sort of, as I call it, like a health stack, right from the AI, the triage, the app, right through to physically, getting medication through to you, handed to you, real, same day, next day.
Great. Well, looking forward to catching up again soon. For now, though, Jason, thank you again for your time today.
Thank you. Thank you for your time.
Cheers.
If you enjoyed this interview, then give us a thumbs up, a like or a retweet. Subscribe to us on YouTube or follow us on Twitter and hit that notification bell to be the first to know when we release new content. There's loads of great content on our website too, across all our programs at stockboxmedia.com. Thank you for watching.